Hi, this is Paige Navarro, and this is our musculoskeletal exam for Maryville University Advanced Health Assessment. This is our practice patient, and he'll read our release statement.
I, Hayden Bowen, voluntarily give Maryville University permission to record my image and or voice and grant Maryville University all rights to use this recording in any medium for educational or other purposes that support the mission of the university. I understand that the following information will be gathered by a Maryville University student as part of a course assignment. I give my express consent for this information gathering and physical assessment to be filmed and posted in the student's course shell for access by faculty and students at Maryville University. I further acknowledge that since the recording is for educational purposes only, the information is not meant to be diagnostic. Therefore, Maryville University and faculty, staff, and students are not considered liable. The recording will be deleted by the student in any of their devices as soon as it has been reviewed and graded by the instructor.
Awesome. So I've introduced myself to the patient, done hand hygiene. We are in a private environment, so we can begin our assessment. The first thing we're going to do is palpate the temporomandibular joint. We're going to assess for tenderness and any clicking. Then we can move on to the neck, where I'll have him first test this flexion, the chin to chest, and then extension with looking up to the ceiling. We can do rotation by looking from side to side, and then lateral bending with the ear down to each shoulder. And we're noticing any tenderness or stiffness with that movement. The next thing we'll do is the shoulders. So the first thing we'll do is we would want to assess the shoulders for any abnormalities, tenderness, deformities, and from the back, and then also the shoulder girdle from the front. And then we'll check for the shoulder movement. So first with extension with arms up above the head, and then flexion with arms back behind. Perfect. And then internally we can check that as well, and then external motion with the hands up above the head from the side. And that will check their shoulder movement. At this time, since he's already standing, we'll do the rotator cuff assessment as well. We'll start with the Hawkins impingement sign by having him lift up his arm like this. And then for this, we'll just rotate this part of his arm down and just see if there's any tenderness with that movement. And then we'll do the infraspinatus sign as well with hands like this. And then he'll apply pressure to my hands as I push him in. And then if that's tender, that could be a sign of rotator cuff injury as well. We can now move on to the elbows and do flexion by bending elbows in, and then straightening them out, checks for the extension, and then supination with the palms down and pronation with the palms up. Also noting tenderness there. And then we can move on to the wrists with flexion and extension, or that one's extension, and then flexion pointing down. We can also do adduction with the wrists by pointing the fingers towards the middle, and then abduction by pointing the hands away. And then moving on to the fingers, we can do abduction by having the fingers be spread apart, and adduction by bringing them in, and then we can do flexion by bringing them down, and then extension by bringing them up. And here you can also apply a little bit of pressure to see if that brings on any tenderness as well. At this point, we can also check for carpal tunnel. We can start by doing the Tinel's sign by tapping on the median nerve here. And if that were to cause tenderness or numbness, then that might be a sign of carpal tunnel. The next one we can do is the Fallon's test, where we bring our hands into the midline. If that caused tenderness or numbness or any discomfort, that might be a sign of carpal tunnel as well. Now that the upper body is done, we can move on to the spine. So we would want to first check for deformities of the spine, any abnormal curvatures. Go ahead and bend forward, and then bend all the way back. That's extension, and then bending forward checks the flexion. And then we can also have you step back over there, and then we'll look at the gait as well. So we'll have him walk about 5 feet over to the dresser over there, and that will check to see if there's any abnormalities with his gait, any deformities or atrophies. We can then move on to, or keep going with the spine by doing the lateral bending from side to side on each side. And then the spinal rotation, like that as well. Now we can move on to hips. If you can first bring your knee up on each side. That'll check the flexion of the hips. And then the extension of the hips will have you lay down face first. This one is done by bending the knee and then having him extend his leg back up that way. And that will check the hip extension. And then go ahead and flip over. Perfect. And then we can check, go ahead and bend. The abduction here as well. Abduction would be out to the side. Adduction would be to rotate the hip inwards. And then we can do an internal rotation like that, and then an external rotation by bringing the foot out to the side. Next we'll move on to the knee. Go ahead and bend your knee. Extension would be straightening the knee. So go ahead and straighten it. Yep, and then flexion is to bend the knee. Perfect. And then here we can also do an internal and external rotation as well by crossing just the foot over the midline and then away from the midline as well. We'll also want to inspect the knee itself for any effusions, fluid buildup, deformities, tenderness, swelling, any redness, anything like that on both sides. We can also check the meniscus by doing the McMurray sign, which we'll have you go ahead and bend. And with this, we'll just internally rotate the foot and externally rotate the tibia there just to see if that causes any tenderness in that area. Perfect. And then go ahead and sit up. This is another part of the knee assessment here, where we'll have him internally rotate each of the feet there. And then on the other side as well. Yeah, perfect. Great. And now we'll look at the feet. Have you point your toes to the ground. That'll check the extension. And then when you point your toes up to the ceiling, that'll check the flexion there. Perfect. And then we can check inversion by rotating the heel inwards. And then eversion by rotating the heel outwards. Perfect. And then there's just one of the other tests that we want to do that'll check the ligaments. Sorry, I'm going to have you lie down again. So this one is done by bending the knee again. This is the Lockman's test, where we want to hold our foot here, or hold our foot up here at the calf, and then kind of push in on the thigh as we're kind of rotating the tibia out away from the midline, just to see if there's any tenderness there. And then the valgus sign is where we also put our hands here on the thigh and then rotate his foot out like this, or internally as well, just to see if that causes any tenderness in the ligaments of the knee as well. And that concludes our assessment. Thank you.